We are here today with Dr. Bartiss himself.
Hey.
Hey, he's actually doing one of our most popular treatments, the MAH Ozone. Can you tell us a little bit why you do this for yourself?
Yeah, for prevention, one, from heart disease and aging and cancers and stuff is really good. I had some heavy metals as well for many, many years. I had a lot of mercury fillings, and I had been eating what do you call it, swordfish, and what's that other fish I eat? Salmon, for many, many years, and found out that I was mercury toxic for many, many years. And one of the reasons I got into out of conventional medicine into this type of medicine is because years ago, I would say about 25 years ago, I found out that I had this family history of heart disease that was bad, and never knew anything about my heavy metal exposures. But I got a couple therapies by another alternative physician of chelation. And after about the sixth or seventh one, I lost my mind. My colleagues thought I was doing crack cocaine. I was out of work for at least 6 months, and ended up what had happened is that the chelation therapy had released from the stores, my brain and my heart, etc., these heavy metals. And nobody could figure out what the heck was what. And then after I got my mind semi back, I figured out this is what had happened. And I was able to fix myself by using more chelation but at a much lower dose. So that's basically how I got started in this therapy type of medicine. In addition to several of my patients in the past asking me about the alternative therapies and simple things like minerals and vitamins. Hey Mark, what do you know about this? I knew nothing about it, and my ego wouldn't let a patient know something that I don't know. So I looked into these therapies, and all of them made sense. So I knew they were going to try them anyway, and I had to make sure that what I was giving them was not going to hurt them in addition to what they were taking. And this is basically how I started, a little bit at a time, learn more and more, and this is the way to go. We help out so many more patients this way than we have in conventional medicine.
Great. Can you tell me a few properties of ozone and why it's a beneficial treatment for people?
Yeah, ozone does a lot of different things. It has probably at least 100 different mechanisms by which it works. Basically, it recruits white blood cells, it helps with the immune system. It's been known to be able to kill off cancer cells. I'm not saying we cure cancer, but cancer cells are destroyed by the use of ozone. The cancer cells cannot live in oxygen, and ozone is a supercharged oxygen. So when you expose cancer cells to ozone, it readily kills off most of those cancer cells. So again, it's not a cure for cancer. It's an adjunctive therapy that people can use in addition, but it certainly also helps people who are getting chemotherapy or radiation therapy so they have less side effects because of the use of ozone. We can inject ozone into a joint and help people with chronic pain from arthritis. You can inject it into muscles, inject it into soft tissues, and get rid of any chronic pain that people have as well.
Great. And why do we utilize the ultraviolet light with the ozone as well?
Yeah, so ultraviolet light has been a therapy that's been around for a long, long, long time. As a matter of fact, it predated the use of antibiotics around the Civil War in times. This is how they treated infections. They would use patients' blood and they would expose it to these different frequencies of ultraviolet light, and they were able to kill bacteria.
Awesome.
Very good in helping boost the immune system as well. And this is why we use it in autoimmune diseases as well. It's just an additional therapy in addition to the ozone, gives an extra kick.
Awesome. Thank you so much.